Welcome to Porchlight, a presentation of Porchlight VNA and Home Care, providing top-rate, highly personalized care to individuals and families in the Berkshires and also in the hill towns of Hampden and Hampshire County. And everyone today is talking about Obamacare. What does it mean? What does the Affordable Care Act mean to businesses, to individuals? Well, one person who knows more about that than most is here, Bryan Ayars, who is the CEO of Community Health Programs, who's also going to be talking a little bit about CHP as well. So, Bryan, welcome to the program. It's great to have you.
Thank you. It's great to be here.
So this is kind of a time of maybe concern, a time of a little bit of anxiety for individuals out there, but also businesses, because the whole idea of affordable care obviously, has great intentions, but the question is, how is it being delivered?
Right.
And then, of course, today with the computer issues and all that, there's even more. So what are your thoughts about what's happening right now?
It's a bit of a mess. There are still people getting enrolled.
In a nutshell.
Yeah, in a nutshell, it's a mess. The intent is good. The implementation has been the huge failing. And at the national level, that's where all the attention is. The states are having challenges too. In Massachusetts, although we did healthcare reform years ago, we've had to make major changes and upgrade the information systems and technology at the same time. So there have been a few glitches. When you pull all the white noise and all the political grandstanding away, we still need to get people enrolled into health insurance. For businesses, the larger insurers got a reprieve into 2015. The smaller employers don't have that reprieve, and they really, by now, should have had contact with their insurance broker or some other expert in the insurance business to help them identify what their next steps need to be. There have been a few delays announced and a few more that will probably be announced, pushing deadlines. My recommendation to every employer is don't wait for the potential delays. Make sure your ducks are in order now so that you beat the rush and any further delays that are going to confound your employees. From the employer standpoint, and we're getting it from both ends, not only do we employ 130, 140 people, but we have to make sure our 14,000 patients have the insurance they need so that we can get paid, so that we can turn around and pay our employees. Sure. So we're paying attention.
Yeah, clearly. And so now if you're a smaller business that doesn't have the sort of, loophole this year or whatever, however you want to describe it, what size company would that be that would need to be doing?
The breakdown has been below 25 employees and 25 to 50. How that gets defined is when you get into the weeds and there's some interpretation, but what one employer would traditionally call a full-time equivalent, the healthcare reform rules don't. So that's where they need to be talking to their insurance broker to help them define what it means. Massachusetts has done a great job on their website, mahealthconnector.org. Employers, large and small, and individuals can go there. Great resources to help define what the current rules are and not perhaps what they were 6 months ago. Because there have been so many changes, most people are very hesitant to say, this is exactly how it has to be, because maybe it was last week. But we're all transitioning rapidly.
Interesting. And so looking at that, you make a good point that healthcare agencies have to be paid, just like any other business. So that's important to you. You have a lot of patients out there who now are covered under this. And so tell me about community health programs a little bit, who you serve and the kinds of services that you are providing. I'm seeing CHP out there more and more than ever before. And it seems like you've grown dramatically.
We've grown tremendously. We started in the 1970s. Dr. Tom Whitfield, and for people who live in South County, many people still remember him. He started CHP from a pediatric practice. He noticed that a lot of his children weren't being seen until they were ready for school. They missed immunizations. They missed all sorts of issues, and they were presenting with major maladies. So the organizational lore is he threw his staff in the back of his station wagon and they drove through the hills of South County looking for toys in the yard and kids' clothes on the clotheslines, and they would go in and visit. And that's how we got started. And then we added what we're now calling our family services. It was a WIC program, an early intervention program for children with developmental delays, and a grant-funded program to create playgroups that were structured for the children and gave the parents an opportunity to do some networking the old-fashioned way, face-to-face. That's how we got started, and that's still what we're doing. But instead of being in a small little office in Great Barrington, we now have sites in Great Barrington, Lee, Pittsfield, and we served 14,000 people last year on the medical and dental side. Our family services serves thousands more than that. So our core population is Berkshire County. We serve a lot of people from New York and Connecticut who like their providers or can't access the services in their communities. And anyone who needs a service, we're willing to provide it if we provide it.
That's very interesting, because here we are in a very rural area, but I would probably make the argument that compared to, and you know better than most because you've been to rural areas throughout the country, in your career, and that's one of the parts of, and we'll be happy to talk about that later, I hope you would. But the Berkshire County and southern Berkshire in particular, for the size area, we have a hospital and we have a great number of services. I think, for most rural areas, we're probably doing pretty well.
We are. The struggle is when you're in a small rural area, you might need a cardiologist, but there's only enough to support one cardiologist 2 days a week or something like that. And other specialties are the same way. Fairview Hospital and Berkshire Health Systems have done a great job of trying to move specialists in and out of the community so that we can take care of the need in the community and people don't have to travel. One of the major barriers to care is the inability to travel. And in Berkshire County, while we have public transit, it's not convenient for a lot of people, particularly if you get off Route 7.
So we have our challenges.
Yeah, we do.
No doubt about that. But of course, since there are people coming from New York and Connecticut, it shows that we're actually drawing people because of our services. We do. The hospital draws just as many people as we do, probably, from the outlying areas. The South County is a vibrant economic area, and a lot of people are drawn to that for healthcare as well as vacationing or just shopping and other events. We've had tremendous growth due to the need in the community as well as the changing national and state environment. The hospitals have had the same growth and struggles that we've had to varying degrees. So let's talk about that a little bit, that sort of environment that we were seeing in healthcare, and you've been in healthcare for a little while and have seen the ebbs and flows and changes. So, we hear a lot about things like ACOs, these organizations getting together and partnering up with all the different entities. It seems like it's happening more quickly in larger areas and maybe challenging out here. The concept behind that, do you think does it work here in the Berkshires?
An ACO was an accountable care organization, and the idea behind it is all the providers get together and coordinate the care. They also share the risk of caring for the individual. Statistically, you need about 500,000 people to minimize the risk. Berkshire County has about 131,000 people. We don't have the risk pool to really make an ACO work. We could work with other communities, but Berkshire County, as vibrant a county as it is, actually has pretty poor health outcomes. So getting people to partner might be a bit of a challenge.
Interesting.
Of the 14 counties in the state, our health outcomes put us around 11th. So we've got a lot of work to do. Part of that is we're an older and poorer population. So ACOs, as an ACO, probably we won't see in the county unless we partner, all the organizations partner outside the area. But there's a lot of collaboration going on, and the communities in southern Berkshire County have always always collaborated. There aren't enough resources to go around. They all seem to recognize that. We host a monthly meeting of nonprofits in Health and Human Services in South County, where they sit and discuss who's doing what and how are we going to do it better and who's going to go where, to make sure that all the patients and all the clients get the services they need. And not only are there no duplications, but there are no gaps. We try to develop a safety net that's really a net and not just a bunch of holes sewn together. South County does that very, very well.
Yeah, it's very interesting. So you've grown dramatically, but you don't necessarily see it because we're just too small. But that's interesting that you mentioned how the outcomes overall in Berkshire County perhaps not as good as they can be. Now we know Porchlight VNA, we have great outcomes with Porchlight VNA, and so that it's just an overall kind of statistic we're talking about there.
It's interesting. Berkshire Health, and even you can go up to North Adams, they earn awards for how well they're doing things. We can show our great health outcomes as well, yet there's a lot of work to be done. We don't get the entire population. Our population is about 10% of the whole county. I think we take good care of those individuals, but there's 90% that we haven't touched yet. Taking care of sick, chronically ill individuals, it gets more and more expensive. And healthcare reform is really focusing a lot of attention on those more expensive patients now. And hopefully funding more in the prevention and wellness arena rather than taking care of the chronic disease.
Right, because there's always that hypothetical or real situation of people coming into the emergency room essentially as their primary care, because something goes wrong, they haven't seen a primary care doctor in years perhaps, and something has gone very wrong, and they show up at the emergency room, which is the most expensive way to treat someone.
Right, and it's episodic care, and the best care is there's a continuum. You know your provider knows you. You have a medical record that's accessible to the right people, and you don't get the wrong medication or over-medicated, and you get very consistent care. Going to the ER, they provide good care, but it's very episodic, and to your point, it's very expensive. The federal government is really putting a pressure on the hospitals to avoid admissions and readmissions. Porchlight does a great job of reducing readmissions to hospitals, which in turn not only improves health outcomes, but reduces the overall cost of healthcare. So, Porchlight's a great example of an organization doing a really good job, a little bit ahead of the curve of where the federal government is.
Which is great to hear, and it is interesting to say about the readmissions, because when we think about healthcare, we go to the hospital, and then we go to home care and so forth. In the old days, or it's still maybe the case in some ways, but if your rehab doesn't go so well, or your home care doesn't go so well, and then you get sick again and you go to the hospital 10 days later, the system would continue to pay for that outcome, which is not a positive outcome because being readmitted to the hospital is expensive. Today, what is being said is that if that person has to go back to the hospital, then essentially, there's going to be a financial penalization there.
Correct. On the outpatient side, physicians, whether it be a community health center or a private practice, or a specialty, they're paid by the visit and then by the procedures that they order. The way the state's going, the national government's going as well, is we're going to be paid. In the 90s, it was called capitation. Now it's called global budgeting. We're going to be paid on the health outcome of the individual. So instead of you coming to visit us 3 or 4 times a year and us getting reimbursed for each visit, Mass Health, for example, will pay us X number of dollars per month for your care. If you don't come in, that's great, unless you're not doing well, and that's not so good. So we and others will soon be paid on a per member per month or per person per month rate, and then an additional piece based on health outcomes. So our job is to keep you healthy and not count how many times you come in to see the doctor, which is going to be a huge shift in how a lot of us do business.
With all that said, though, Medicaid reimbursements are relatively low, after cuts from the federal government and so forth. So any organization, whether it be Porchlight, CHP, nonprofits, have to still raise dollars privately.
We do, yeah. CHP has been a federally qualified health center since 2000. As a federally qualified health center, we do get better reimbursement for the Medicaid, Mass Health, and Medicare patients. But it's still not enough to cover the costs. So to your point, we all have to do fundraising. Our budget, 70% of our revenue is based on patient billing. Only 1%, a little bit more than 1%, is based on donations. Every other nonprofit's got the same challenge. We're here to serve a mission, which is to improve the county, us through health outcomes, and the agencies that support what we're doing don't support us quite enough. And that's where we need to get community support.
Interesting. So we all have that challenge.
But all have that challenge, yes.
But it's an essential service to the community. You pay taxes and you have your roads plowed and that sort of thing. But you also have health care in your community, and you know that if there's something that is, and also we talk about that continuum, the preemptive care that you need in a rural community. And again, as we talked about, Southern Berkshire is they're well served, more than most rural areas. So that's something to think about when you're making your budgets for donations.
That's true.
Think healthcare, especially those nonprofits, and looking at it, you come by it honestly because that's your background. You worked in rural areas. So tell me a little bit about how you came into healthcare in your career and know so much about the rural areas.
I grew up in a fairly rural area in Pennsylvania. My introduction to healthcare was as a 15-year-old volunteering on the local ambulance, and that grew to. Perhaps I was an adrenaline junkie. I became a paramedic, worked for years in a hospital, and then realized that wasn't a life position for me. So I went into a leadership role, went back to school, and have worked in aspects of healthcare ever since then. Ran a hospital, oversaw programs for a state agency, and did a lot of consulting before I came here. And the position here and the challenges here are kind of a culmination of all the other things I've done. So it's nice to be able to bring them all together. And there's a great leadership and staff at CHP, which makes it all that much easier.
Yeah. Well, Bryan was telling me about
18 flights in 10 days. Yeah.
18 flights in 10 days, and to think, having healthcare be a focus. We think we're rural, but when you're in somewhere in Alaska where the only way to get there is by plane, that's really very rural.
One of the communities I was in, 2 days after I left, the hospital CEO broke his leg in his house. He went to the hospital. They had to wait for the weather to break to put him on a boat to take the boat to the mainland, and then flew an hour and a half to Anchorage. That's rural healthcare.
So we're like almost like a metropolis.
We've got it pretty good. We have our access issues in South County, but there are a lot of good things that go on in South County that probably a lot of people don't recognize until they need them. There are a boundless number of agencies that want to make sure everybody has all the services they need, whether it be home heating oil, food, health care directly, all these determinants of health. None of them are funded well, but South County has a wealth of organizations trying to make it right. So it's a special community.
And we think about CHP, and because we see your name so often here in South County, and that's where CHP is originated, but your mission suggests that it can be all of Berkshire County, and certainly you serve people from outside Berkshire County as well. So where do you think you're headed as an organization? Do you, again, I think you said something like 700% growth in the past several years.
In a decade, we've had about a 700% growth in the number of visits. A lot of our growth has been in response to the needs in the community. Our core population is the uninsured Mass Health Medicare patients. because we get an enhanced reimbursement, we can afford to treat these patients, and we treat them very well. And the private practice physicians can't always afford to do that. Whether they want to or not, it becomes an economic challenge for them. So that's a large part of our growth. When the economy tanked, the demand for our services really went up. We want to make sure people don't have to go to the ER as a last resort, so we bring them in. We average 100 to 150 new patients every month. Not just because there's no place else to go, but we've got 20 or so really well-trained, excellent providers.
Right.
Pediatricians, family practice, internal medicine, OBGYN, dentists, nutritionists. We run the gamut of primary care. We want to make sure whatever somebody needs, they can get it.
So the demand is there for the services and the ability for you to provide services for them at certain reimbursement, and you as an organization is able to basically negotiate with the government in a better way than maybe just a doctor's office on their own.
There is no negotiating. Well, this is what we will pay you.
Okay. That's the negotiation with the government.
That's the negotiation. That can be the negotiation with the commercial insurers as well.
I see. Right.
We have the distinction of being small compared to the Boston market. So insurance companies will not really emphasize what's going on in our communities. We're of a size now, and with the multiple services we provide, we can at least have some negotiation. But with the federal government and the state government, we know what we're going to get paid by visit, and our job is to make sure that our costs are under that payment.
And then overall in Berkshire County, because we always talk about how in whether it's in businesses or different organizations, that we do our best to partner well in the Berkshires, and you also hear other things about sort of turf wars, different organizations having their own interests. In being in other communities over the years, tell me about Berkshire County and what it's like sort of working across different organizations and how well we work together.
For the most part, I think all the organizations work well together. You've got some personality differences, and that just is kind of the fabric of life. Compared to many other rural communities and other urban communities, the agencies here work well together. There's long been a recognition that there are more people that need our services than what we can all provide, and the resources are slim. So to spend, or I would say waste our resources competing with somebody else to take care of a patient who we're going to lose money on is kind of silly. So let's consolidate our resources as best we can and take care of our friends and neighbors. And South County does a great job of that. People from other areas come in and they're just amazed that there are these just wide open referral networks. Nobody's calling turf. It's here's a patient, how are we going to take care of them? Right.
And that's really what healthcare should be all about, right?
And it's not just healthcare, it's all the other social services as well.
Yeah, indeed. Because in the end, it is about the outcome. And we talk about improving that, and we talk about that quite a bit on this show, about the outcomes, because Porchlight is very proud of our outcomes. And so in the end, if you're not getting that, then what are we doing?
Right. And one of the necessities of collaborating and working well with others is if we have a patient who can't afford their medication, or they have their medication but they don't have any food, or they can't afford to heat their home, we're not doing them any good. So if we can't provide that service ourselves, we need to find out who does. And we've got staff in place that does that, and they do a really good job. And there are agencies throughout the community that they're trying to do that as well.
Fantastic. And as we have about a minute left, Bryan, how can people learn more about CHP? I know you have a new website.
We've got a brand new website. It just went live in October. There are still a few things we need to add, but communityhealthprograms.org is our website.
And that's plural, Community Health Programs.
That's correct. Thank you. Yep. That's our website. All the contact information is on there. For individuals who are concerned about losing or changing health insurance, they can get information there as well. And we've got enrollment specialists at every site to help individuals get enrolled or re-enrolled in their insurance plans. Fairview Hospital also has individual through advocacy for access to do the same thing. But if individuals have questions, they can get to me through the website, or they can get to anybody else through the website as well.
Fantastic. Well, Bryan Ayars, a great pleasure to have
Thank
you on
you
the
very much.
program
It was
for
a
the
pleasure.
first time. Wonderful discussion and very interesting. And
Great.
we'll have to bring you back again sometime
Happy to
soon.
do it. Thanks.
Thank you so much.
All right.
And this has been Porchlight, a presentation of Porchlight V&A and Home Care. Thanks for watching.